welcome everyone to the Wednesday Zoom news conference for the latest in COVID-19 information for the Amarillo community. We do these every Wednesday at 11 a.m. Let me go ahead and introduce briefly who was on our panel today. We're joined by Amarillo Mayor Ginger Nelson, Casey Stoughton, Public Health Director for the City of Amarillo, Dr. Todd Bell, Deputy Health Director, Texas State University Health Sciences Center, Dr. Brian Weiss, Chief Medical Officer for Northwest Texas Hospital, Dr. Michaellemantier, Chief Medical Officer for BSA, Dr. Rodney Gonzalez, Director of the Amarillo VA, and City Manager Jared Miller. What we'll do is we'll turn it over to our panel for some brief statements, and then we'll take questions from our media. Let's go ahead and start with Amarillo Mayor Ginger Nelson. Mayor, how are you?
I'm well, thank you, Dave. Amarillo, I just want to say this morning a word of gratitude. How much I appreciate the efforts that you're making to adapt and to change your lives so that we can be open and we can keep living life here in the great city of Amarillo, even amidst a worldwide pandemic. So thank you for the patience and the grace that you're showing to make the changes necessary to support our medical community, but also just to support each other. And I want to thank you especially for shopping with our local businesses. That's what will help us stay strong economically and start our economic recovery to be on the road where we want to be, back to a pre-COVID economy here in the Texas Panhandle. So thank you for doing your part. I greatly appreciate it. And I wanted you to know that many of us, especially business owners, are watching and want to express our appreciation as well. Dave?
Thank you, Mayor. This time it's now go to Casey Stoughton. Casey, how are you?
Good. Thank you, Dave. Good morning, Amarillo. As of yesterday, there were a total of 4,924 cases of COVID-19 in Potter and Randall counties, 3,419 in Potter County, and 1,505 cases in Randall County. We have a total of 4,048 recoveries and 59 deaths reported in our community. That leaves us with a total of 817 active cases. Each of the cases do represent a unique individual. The public health drive-through does remain operational. You can call 378-6300 and be directed to testing. Since opening the test site, we've tested over 6,500 individuals. That's a really amazing job. There's less than 10 people at the test site manning that operation, and so they've done a tremendous job. We continue to work with each of the 5 school districts in Potter and Randall County with methods and recommendations to help keep our children and staff safer when school starts. We appreciate the planning each of the districts have taken and understand that this will be an ever-evolving effort. If you love juice and snacks as much as I do, you should consider donating blood with Coffee Memorial Blood Center. They use your donation for life-saving blood, and if you have recovered from COVID-19, then they can use that convalescent plasma to help treat others who have COVID-19. And that one donation of convalescent plasma can be used for up to 4 other individuals. So please give Coffee Memorial a call today to donate blood. The Public Health Department continues to work with individuals through contact investigation. We're continuing to see many smaller clusters as opposed to the 1 or 2 large outbreaks that we saw in April or May, indicating community spread. So it's important that we remain vigilant in wearing a mask, staying 6 feet apart, staying home when we're sick, and practicing good hand washing. These efforts can continue to slow the spread of COVID-19 in our community. Thank you, Dave.
Thank you, Casey. This time I want to welcome Dr. Todd Bell, Deputy Health Director, Texas State University Health Sciences Center. Dr. Bell, how are you?
Good. Thank you, Dave. First of all, I just point out that across the state of Texas, we're actually starting to see the positive effects of improved compliance with those public health recommendations. A combination of masking and physical distancing and hand washing has decreased the 7-day average across the state. It's important that we continue using these effective measures, and again, just would encourage people to continue to comply with that. That's going to be what gets us through this until such time as vaccines and other therapeutics are available. I would encourage people to comply with that and appreciate the community's diligence in that regard.
Thank you, Dr. Bell. This time, let's now go to Dr. Brian Weiss, Chief Medical Officer for Northwest Texas Hospital. Dr. Weiss, how are you?
I'm doing great. Good morning. Hey, I was really hoping this great rain we have would wash this virus away, but not sure that happened. So hey, I want to talk a little bit briefly about testing. So up to this point, most of the testing that we've been doing is with these nasal swabs and deep nasal swabs or the throat swabs. And this testing is designed to try to detect the genetic material or the genes of this virus. And they do it using a technique called polymerase chain reaction or PCR. That takes a little time for us to amplify these genes and see if we can detect them. Now, so that's what's made some of this testing kind of slow. Now, our hope is to go to what's called antigen testing. And that means, can we detect in the blood part of this virus that's not part of the genetic material? So that could be like a protein on the surface of this virus. We use antigen testing for lots of infectious diseases, and it tends to be a very rapid turnaround. So a lot of the government officials are saying that's what we need to go to get some more rapid throughput for this testing. Now, the third is antibody testing. Now, antibodies, to remind you, that they are kind of the customized spears that our immune system uses to fight off the invaders. And antibodies come in several classes. One is called IgM. IgM is the first response of our immune system. And we know that IgM levels rise during the active infection. After that, you start to develop what are called IgG antibodies. And that is the long-term protection. So IgG antibodies give us memory to those invaders that we've seen in the past. And when we re-encounter them, that gives a very robust response to the immune system to try to stop that infection. Now, the reason I bring this up is Northwest is now able to offer antibody testing at our freestanding emergency rooms. Now, so this testing, basically, it takes about 30 minutes to turn around. We'll ask that anyone that comes stays for 30 minutes in the car to wait for their results. It's about $120 cash to get this testing. Now, here's the caveat. That antibody testing gives us both IgM and IgG results. If a person is positive for IgM, that's that fast-acting antibody, we have to assume that they may be actively infected at that time with the virus. And that positive test will be reported to the public health department, and that person will be expected to follow the guidance of the public health department as if they have an active infection. So it's important to know that if you get your antibodies tested, IgM may be seen as a positive or an active infection. The IgG tells you you've seen that virus at some point in the past. Another important thing to remember is we are not sure that the IgG generated by COVID-19 makes you immune from getting the infection again. So that's important to remember. Let me talk about the numbers at Northwest. Right now, we have 27 COVID positive patients in the hospital. Over the last 2 weeks, we've been somewhere between about 23 and 28 the entire time. We have 10 patients in the ICU. 6 of those are on ventilators right now, and we're using less than half of our current ventilators in the hospital. In terms of remdesivir, we have 136 vials in the hospital. That's enough to treat 13 or 26 patients on whether or not they get 5 or 10 days of treatment. Currently, we have 7 patients on active treatment. I want to bring up, there's been some comments about hydroxychloroquine again in the press. In the last couple of months, there have been some excellent research articles from around the world looking at this drug to treat COVID-19. And the conclusion is the same across the board. They cannot detect a significant benefit to using this medication to treat COVID-19 patients. In fact, the American College of Physicians came out with an editorial last week in which they said they consider this conversation done. And they're saying there is no indication to treat either inpatient or outpatient COVID-19 patients with hydroxychloroquine. So we're not doing it in the hospital, and right now there's no indication for us to change that. Lastly, we are continuing our elective procedures. We feel confident we have enough personal protective equipment to do this for quite a while. And lastly, we're continuing to use nurses that we have obtained through the Regional Advisory Council. We really appreciate their help in having these nurses work with us, and they are working alongside our very committed and hardworking staff, and all of them are doing a fantastic job taking care of the COVID patients. That's all I have this morning. Thank you.
Thank you, Dr. Weiss. Let's now go to Dr. Michaellemantier, Chief Medical Officer for BSA. Dr. Lementier, how are you?
I'm doing well. Good morning, and thanks for letting me join the call today. I'll start off with some of our numbers here at BSA. Our overall hospital census today is at 286 acute inpatients. This is close to where we typically run this time of year in terms of our total hospital volume. Our ICU capacity at this time is high. We're at about 90% in terms of our ICU capacity, and the bulk of those ICU patients are non-COVID. We are at 37 confirmed COVID cases in-house today. We've had numbers hovering in the mid to high 30s now over the past 1 to 2 weeks. And again, we'll drop down and discharge a bolus of patients, and then we'll have another handful come in and require admission. Of those patients that are admitted, we right now have about 16 in the ICU, and about 10 of those patients are requiring mechanical ventilation. We're using almost 60% of our total ventilator capacity currently. We still have a lot of high flow nasal cannula equipment available in terms of that capacity. And we still have a lot of our surge plan ventilators available beyond that statistic that I just quoted in terms of vent availability. It's pretty clear that we are in the midst of a second surge. I mean, obviously, we had numbers several weeks ago that had dropped down to where we were single digits for a couple days in the hospital. And then we've risen again subsequent to the 4th of July to the numbers that we're at today. It is encouraging to see that we're starting to see some improvements across the state of Texas, although I think we need to be cautious that we are at risk for another significant tax on our hospital systems here in Amarillo if we're not abiding by the current guidelines in terms of safe practices with masking, social distancing, frequent hand washing, et cetera. Again, we have been using multiple modalities to attempt to treat COVID-19. The ones that have the most evidence and the best evidence right now really are remdesivir and dexamethasone. And again, we've abandoned other drugs that really have not been shown to be effective, as Dr. Weiss has mentioned, in terms of where the bulk of data now lies, even though we still are awaiting additional trials to come forth with hopefully some more positive information. I think we all should be excited about some of the progress being made across the country with our experts that are working on vaccine development. It sounds like we're starting stage 3 or phase 3 trials with a couple different types of vaccines. And hopefully we're going to have something available for healthcare workers and then the rest of the masses of our population thereafter in the not too distant future. We have not had to seek outside assistance for nursing staffing at this time, although it's been a situation that's being monitored very closely. We currently today have 19 nurses that are quarantined, and the local Department of Health has been working very well with us in terms of revising our guidelines to match CDC recommendations to have folks come back to work in a safe fashion in the shortest time period allowable or permissible based upon what we know about potential transmissibility. We are very fortunate that we're not seeing high numbers of folks become infected because of workplace exposures. Really, it's the bulk of these being community exposures because of how prevalent the disease is at this time in our region, across the state, and across the country. I think the other thing that I'd like to mention is that we're continuing with elective cases. We are watching our ICU volume closely while doing so. We are potentially limiting cases that may require an ICU bed when we look at the OR schedule a week in advance. Our surgeons have been fantastic with working with us, as well as our patients that are in need of these surgeries in terms of trying to spread them out and not tax the system too heavily. And then I would say, lastly, on testing, we have tested now about 6,400 patients since the outset of the pandemic, and we continue to be about 18% of our total tests have been positive. In terms of our pre-admit testing protocol, which is the protocol we put in place for people that are getting elective procedures and trying to determine which ones need to be tested beforehand, we're being pretty liberal with that testing, but still less than 1% of those patients are coming back positive for COVID-19, which we're pleased with in terms of those individuals, I think, are doing their best to adhere to guidelines to not get infected and try to be quarantined before their procedure so that they decrease their own personal risk of having a potential complication around surgery. And there is some data that says that really that is a potential risk. So again, I'd like to commend the folks in our community for doing a good job of abiding by our masking policies and guidelines that the mayor has been promoting. I've seen more of that in the community, and I'm pleased to see that and people abiding by it. I can tell you that our elderly population and those that are infirm for whatever reason are very appreciative of that as well, because they're quite frankly, they're frightened about getting infected. And I think there's good reason for that for some individuals. So again, thank you very much for letting me speak today. We want to thank our nurses and our staff at BSA for doing a great job in terms of managing all of our patients. And we're here to help everybody as much as we possibly can.
Thank you, Dr. Lementier. At this time, let's now go to Dr. Rodney Gonzalez, Director of the Amarillo VA. Dr. Gonzalez, how are you?
I'm doing well, thank you. So first of all, good morning. Thank you for this opportunity to talk to our veterans across the Texas Panhandle. As to our numbers, currently we have 2 inpatients, both of which are in the ICU. Neither one is on a ventilator. We do have 17 veterans that are on home isolation that are COVID positive, and we have 2 PUIs that we are awaiting their test results to come back. Would like to happily report we are up to 34 recoveries of our veteran population we are tracking. We continue to have our no visitor policy here on the VA campus for the Amarillo healthcare system that applies to both our Amarillo campus and our other campuses, except for times where a caregiver is needed. Do want to remind our veterans, we do have limited face-to-face appointments for routine care available. However, I know sometimes either they are unable to get one of those face-to-face appointments or they may be hesitant to come in, and I want to remind them, we continue to offer our virtual appointments both through the telephone and through video through our VA Video Connect. And so for veterans who are interested, make sure you talk to your healthcare team to see if that's right for you. And lastly, I just want to take this time to wish our Coast Guard veterans a happy birthday this coming Tuesday on August 4th. Coast Guard is going to celebrate its 230th year of protecting our nation's maritime safety and security. And while today our nation's Coast Guard veterans have been charged with protecting our borders and seaports, prevention of drug smuggling, and saving lives of distressed individuals out at sea, and would like to remind people that's often in very severe weather conditions. They may have very small numbers, but what they do is great and very courageous. And so I want to thank them and what they do in protecting our nation. And I'll say Semper Paratus for them. And thank you to the City of Amarillo and Mayor and to our staff for allowing me this time.
Thank you, Dr. Gonzalez. Now I want to go to City Manager Jared Miller. Miller, how are you?
Doing good. Thank you, Dave. I want to remind everyone that the drive-through testing center remains open. If you feel like you got symptoms that are consistent with COVID-19, excuse me, call Public Health Hotline at 378-6300. You'll be screened for the drive-through testing center. The location of the testing center has been moved. We have it at a city-owned property downtown, and directions to the location will be provided when you call the hotline to be screened. I want to remind everyone that we're still under the governor's orders GA-28 and GA-29. Under GA-28, there's no occupancy limits on essential infrastructure, religious services, local government operations, childcare services, youth camps, and recreational sports programs for youth and adults. Everything else is under a 50% reduction or a 50% of their listed capacity. The exception to that is that bars are still closed, and as well as rafting and tubing services statewide. We don't have any indication from the governor as to when that's going to change or any of the occupancy limits are going to change. I've had a number of questions from bar owners and other people regarding when bars might be able to open. I just want to make sure that everyone understands we don't have any indication from the governor yet as to when that might change. With regard to the governor's order GA-29, we are required to wear masks anytime we're in commercial facilities, commercial buildings, or we can't maintain social distancing when we're outside or in other places. There are exceptions to that. So we do have to wear face coverings when we're in those places, unless we meet one of these criteria. Any person younger than 10 years of age, any person with a medical or disability that prevents wearing of a face covering, any person while the person is consuming food or drink or is seated in a restaurant to eat or drink, Any person while the person's exercising outdoors or engaging in physical activities outdoors and maintaining a safe distance from another person is not in the same household is not possible. Any person while the person is driving alone or with passengers who are part of the same household as the driver. Any person obtaining service that requires temporary removal of the face covering for security purposes, like doing Face ID on a phone when you're making a payment or electronic payment or something like that. Any person while the person is in a swimming pool, lake, or similar body of water. And then finally, a number of situations where, while it's not required, it is strongly encouraged from the governor to continue to wear face masks. So any person who's actively providing or obtaining access to religious worship, still recommending to wear that face covering. And any person giving a speech for broadcast to an audience, still recommending that when we're doing that, we're wearing the face mask when we're not actually giving that speech. Not accepted from the face covering requirement is any person attending a protest or demonstration involving more than 10 people. That's all we have, Dave. All I have.
Thank you, Jared. At this time, we now want to go to questions from our media. If you have a question for an individual panel member or the panel as a whole, that's perfectly fine. Let's go ahead and start with News Channel 10. I'm not sure the reporter. I'll let the reporter introduce themselves. That way I know it's correct. Welcome, News Channel 10. How are you?
So we haven't had any changes to the way that we list deaths, and the total number of deaths on the state website is the exact same, save for there was one death that was listed in Potter County that the state has listed in Randall County. That's likely a clerical error on somebody's part. On the death certificate, the address was likely listed in Randall County while we have a Potter County address. And so, no, I think that really shows that the communication between the hospitals here in our community, the justices of the peace, and the health department is so strong that the state's data matches our data. And so I'm really proud of that number.
Awesome, thank you. And with more than 800 active cases, are contact tracers still calling every case every day? And do you know about how many people are contact tracing now?
Yes, so we're still using the same process that we used even when we had active cases in the thousands. And so we have the flexibility to increase our staffing as needed. Right now, we have probably around 10 or so contact tracers every day, but we do have the ability to staff up into the, up into probably the 50s. And we did that when we had large numbers of active cases.
Got it, thank you. And is, the state is reporting deaths by ethnicity. Is the city planning to maybe do that as well? And also along with ethnicity, maybe income levels of the people that are getting this virus?
So the state, it looks like they're reporting specific demographic information on the total fatalities statewide, not necessarily by county. And so that's something that we can certainly look at with our team and look at with the state, but that there will be more information to come likely in the future. We can certainly look at different options.
Thank you. And do you know how quickly the drive-in results for testing are coming back, and that as compared to the hospital testing?
I don't know. The hospitals have certainly different, and I'll let them speak to their results. The drive-through testing, we generally range from 48 to 72 hours, and that depends on lab capacity. Sometimes it's a little bit longer. I think the hospitals have different capacities, and so I will let them speak to their capacities. But but that's the drive-through capacity right there.
I just say in Northwest, so we have a rapid turnaround test, which is a PCR-based test, a genetic test that comes back in an hour. But we've struggled to have enough quantity of that kind of test. So we're very careful about the use of that test. Our send-out PCR test or nasal swab is the same as what he's saying, about 48 to 72 hours turnaround time. And then this antibody test, which again, will be done in our freestanding emergency room, has about a 30-minute turnaround time and may indicate an acute infection and may give you a sense of whether or not you've had that virus in the past.
Got it. Thank you so
And
much.
Dr. Weiss, would you say that it's probably very important to use those very rapid turnaround times on the most critical of patients?
Yes, so exactly. We're doing that. We're using that for our medical staff, but we have to know quickly whether or not they're positive. Obviously, patients who might be going to an emergent surgery. So yeah, we're reserving those rapid turnarounds just for very specific individuals that we just need a quick response on.
Thank you. Thank you all. That was all my questions. I appreciate y'all for your time.
Thank you. At this time, let's now go to KAMR Channel 4. I believe we have Aaron Langston. Aaron, how are you?